We're not perfect by any stretch of the matter, but we're trying to do right and to do our best.
If you don't mind, I'd like to go back for just a second to the fact that as you know, all these good people that you have here, you've also been a very good corporate citizen in the city of Irving. This is not the only facility that you have, and we'll talk about the Prostate Seed Institute in just a moment. But in terms of encouraging other young people to get involved in the medical industry, you've done something really special with the Schools Foundation.
Well, there's the public kids, you know, they're working hard and they're going to go on to higher level educations, and we've had a little foundation. We do run a foundation. We've made a donation to the local endowment to help the young people attain their goals, and we've got to meet some of the kids and they apply for it. I mean, it's not a huge thing, but it's something, and I think hopefully you can help them along the way a little bit financially, but it's merit-based. And so they can put on the resume and that this is an award that they want, and I think that's wonderful. They can feel good about themselves.
Well, I can say from a parent perspective, I have an 18-year-old who's about to go off to school at Columbia. Every bit helps.
Yeah,
Absolutely. Absolutely. And I think it's very admirable that, that you give back to the community in that way, because it furthers what you're doing here. You've got all of this great state-of-the-art technology, and of course that's going to improve even more as we go along. But if you don't have great people like you've got in place here, and if you don't nurture great people coming along, that changes, I would think.
We have a responsibility, we all do as adults, to be good role models. That doesn't mean it always works out right all the time. It doesn't. But we need to be a good role model. There's young people, and they need that.
Yeah, yeah, absolutely. I do want to talk a little bit about the Prostate Seed Institute. I'm going to say I have an uncle who passed away with prostate cancer back in the 80s, and the treatment that you are able to provide now wasn't available then.
Sure.
And you have to wonder from a personal point of view if my uncle would have lived had he gotten prostate cancer now as opposed to, you know, in the 80s.
You have to understand that prostate-specific antigen, PSA, the tumor mark, is about the best tumor mark we have for any cancer. It's sensitive but non-specific, means the public is not perfect. It came into use in the late 80s, and because of that, and because of technology, we were able to pick up the cancers a lot earlier. So you could find the cancer a lot earlier, and then the treatment algorithms started to change. The surgeons were doing open radical prostatectomies, and then the radiation therapy data started coming out, and it was pretty good, and then we looked, it was pretty comparable to surgery. And then the computerized equipment was evolved, and we can give radiation a lot more focally, a lot more intently, and staying off other tissues. And then the surgeries evolved from open radicals to robotic or laparoscopic radical prostatectomies. The surgeons are getting better. Well, I have no problem with surgery. I think for certain people surgery is fine, but radiation works pretty darn good too. And whether you want to come through for 8 weeks of extraluminal radiation works pretty well, or I do a lot of seed implants. And seed implant, or we call brachytherapy, brachy meaning closed, therapy meaning treatment. Okay. Closed treatment is when you put radioactive sources into the tumor. And we've developed a technique to put little small radioactive seeds into the prostate gland. It takes maybe 45 minutes or so, and make a really intense cloud of radiation to sterilize the prostate gland. Huge, huge doses of radiation, very conformal with low energy seeds. And if the cancer is local and you get the dosing like that, it'll kill the cancer, sterilize the entire prostate gland. The guy's cured. And it takes us an hour to do. The guys, you know, don't have a catheter. They go home an hour or two after we're done with the procedure. They take it easy for a day or two, and they go back on their way.
That's just extraordinary. That's just extraordinary to go from someone who has a cancer that is life-threatening to someone who comes in, has an hour operation.
Yeah.
And
you don't even open the patient up. You're putting needles through the perineum, under the pubic bone, in the prostate, and we're surgically implanting these radioactive seeds. I explain to the patients, I try to put in their language, we're surgically placing radioactive rice into a meatball. That's what we're doing.
That's a great
image.
Well,
they need to understand, these people, they need to understand this. I try to figure out what hits home to them. Oh, doc.
That makes sense.
And you put the radioactive seeds, they're a millimeter wide, 4 millimeters long, put about 100 in the prostate, with computerized technology, not random or haphazardly, in and around the prostate gland, so you can mold that dose into it. Stay off the rectum, stay off the urethra. And for patients with low-risk disease, we cure 92 to 93% of patients. The risk of urinary incontinence is minimal. We don't have to cut the urethra like we do in a radical prostatectomy and sew it back up, so you don't have risk of leakage. You don't have any shortening of the organs down there, you know. You don't get penile shortening with it. You know, erectile function is really very good in our patients. And the treatment works. So you have a truck driver, the guy's working all day, they can go in for radical prostatectomy or come in for 8 weeks of beam radiation, but come in and get the same outcome as you can with the radical surgery. The outcome data is the same. Stage for stage, grade for grade, it is exactly the same. Surgery is no better. The guys come in, we'll go in on Friday morning, we'll do it, and they'll go home, take it easy on the weekend, back to work the next Monday and whatnot. They have a little urinary irritability for a while, but it's a wonderful alternative. It's a great treatment. It's popular. I've done 2,700 cases or so.
Wow.
People come to us from all over North Texas, and we have people that come to us from other areas, and we put them up in a hotel and do it, and it's very popular. The hardest part is getting the word out to the patients that some of this is available. I have a website, www.prostateseedinstitute.com, that they can go look at and read about, and it teaches them a little bit about this. And the hardest part is just educating the patients. They know it's available and ask, and then they can have all their options and make their decisions.
And know what they want to do for themselves.
Yeah.
Yeah, that's wonderful. I'll tell you, in wandering through the clinic and looking at, and I shouldn't call it a clinic, the cancer center, and taking a look at all the different kinds of equipment and ways that you guys handle the various kinds of treatment for cancer, I'm looking at these computers and watching these images move around. It's almost like science fiction, but these are proven things that you guys have been doing now and really getting great results. What kind of patient feedback are you getting from the folks that you're helping?
I think the patients have been very happy. We have a quality assurance program. When I do a seed implant, we've got to come back a month later and check the quality of the seed positioning, make sure we're happy with the dose distribution. Taking care of patients, we go back and we assess how they felt about us. And we write to them, and we have postcards that they send back their comments. And then our nurses come in and say, Dr. Echt, this is what kind of feedback you're getting. So we check.
Yeah.
We do check.
And that feedback can also help you put improvements in place where you need to.
Oh, absolutely.
Yeah.
We need to do a good job every day. We need to do a good job tomorrow. We want to earn a good reputation, but remember, what we did yesterday was yesterday. We've got to be doing a good job tomorrow for the people that are coming to work with us, and we stand by that.
I'm going to ask as my final question, as the boy who knew he wanted to be a doctor at 3, now has a cancer center here in Irving, one in Wise and in Decatur, and the Prostate Seed Institute. You're helping a lot of people. You're helping a lot of people.
We're trying our best.
How's that working for you, Dr. Echt?
Well, it's a wonderful thing. I'm very proud of it. Sometimes bureaucracy is tough, but we're very proud of what we're doing. We don't have this goal to be the hugest, the greatest, the biggest. We do have a goal to do a good job and earn a reputation. There's economics in play, and we do know that we have to exist. We need to figure out how we can do a good job providing top-notch care and be able to keep our doors open. We're very proud of what we're doing. We have good people. We have a good program. We have a very good location. The people here are wonderful. The people in Irving, their surrounding area, are just nice folks. And we like that.